Let's talk a bit about cell therapy. Over 2,000 years ago, Hippocrates was already claiming that the body contains within itself the power to rebalance its humors and heal itself. Little did he know how right he was. Among the trillions of cells which make up the human body, stem cells may be used to heal, prevent, or alleviate a disease. When it divides, a stem cell produces two cells, a differentiated cell, which will participate in forming mature tissues, and a similar stem cell, which will give it the capacity to multiply over and over again. Stem cells are the promise of a bright future, and contribute to our own future. Today, they are capable of replacing the blood of patients who suffer from lymphomas or leukemia. Tomorrow, why not regenerate a kidney or a liver from a part of ourselves? There are in fact 4 types of stem cells, based on the various tissues that they are able to produce, and on the stage of human development. Totipotent cells, where we all start out since they are created through the fertilization of the ovum by the spermatozoid, are capable alone of reconstituting a complete human being. As they reach the embryonic stage, they give way to pluripotent cells, which are capable of independently reconstituting all the tissues of the human body. Cells are then said to be multipotent when they can create a limited number of tissues. Finally, unipotent cells are only able to generate one type of tissue. Let's go back to the proven results of cell therapy. Here is a hematopoietic stem cell. It is multipotent and is able to produce all the components of blood: white blood cells, red blood cells, platelets, and therefore can heal blood cancers. The first major breakthrough in cell therapy was achieved in 1959 when the Frenchman Georges Mathieu succeeded in transplanting hematopoietic stem cells from bone marrow. In 1988, Elian Gluckman succeeded in the first hematopoietic stem cell transplant, this time from umbilical cord blood. Bone marrow and umbilical cord blood are the two sources which are capable of producing these cells in sufficient quantities to be used therapeutically. Blood contained in the umbilical cord may be collected by maternity hospitals which are authorized to do so, and stocked in publicly approved banks in a joint effort to treat patients worldwide. In some countries, however, it is possible to keep this blood for your own child, in the hope that medicine will continue to improve. Let's have a look at another type of multipotent cell. Bone marrow, the umbilical cord, and fatty tissue all contain mesenchymal stem cells. These are able to produce bone tissue, cartilage, fatty tissue, muscles, or blood vessels. A promising future is anticipated with over 100 clinical trials currently conducted around the world to treat diabetes, scleroderma, myocardial infarctions, among many more diseases. Even more promising, in 1998, the American James Thompson isolated an embryonic stem cell. The scientific community has placed high hopes on its use to treat the most serious diseases: Parkinson's, multiple sclerosis, Alzheimer's, or spinal cord injuries. Imagine a cell capable of producing and replacing all the tissues of the human body. However, clinical trials often have difficulties in being approved because their applications go beyond the scope of science and raise political, ethical, and religious debates. Indeed, when does life actually begin? In 2007, Japanese researcher Shinya Yamanaka developed an induced pluripotent stem cell. He used a cocktail of 4 genes in order to rejuvenate adult skin cells into cells which have embryonic properties and are thus capable of producing all the tissues of the human body. In other words, this discovery encompasses all the advantages of an embryonic cell without raising ethical issues. Though the technique still requires refining, it represents a revolutionary advance, resulting in 2012 in a Nobel Prize in Medicine for Yamanaka and his colleague James Gurdon. That's right. Indeed, we stand before tremendous opportunities. Scientific progress is increasingly rapid and innovative. In fact, leading economists consider that the information and communication cycles have given way to the cycle of complete health. Tomorrow, major innovations will stem from the health sector and will need to answer several criteria: their capacity to influence economy, politics, and society as a whole, and cell therapy is already well positioned.